Did you know that a staggering 80% of all medical diagnoses require blood work? And yet errors in phlebotomy contribute to up to 75% of all laboratory errors? Phlebotomy, the act of drawing blood from a patient, plays a critical role in medical diagnoses. It's a procedure as common as a heartbeat in healthcare settings, from routine checkups to emergency room visits. Despite its prevalence, the shocking reality is that phlebotomy errors account for a significant proportion of laboratory mistakes. That's right, a whopping 75%. For those of you unfamiliar with the term, let's break it down. Phlebotomy comes from the Greek words phlebo, meaning vein, and tomy, meaning to cut. It's essentially the process of making an incision in a vein with a needle. The procedure itself may sound simple, but it requires a high level of skill, precision, and care. The blood drawn is often used to facilitate a myriad of tests, each one integral to diagnosing and treating a patient's condition. Now imagine this: you're a healthcare professional. You've mastered the art of phlebotomy, navigating veins with the finesse of a seasoned sailor. Each draw you make can mean the difference between a correct diagnosis and a medical conundrum. The pressure is immense, the stakes high. It's easy to see how errors can occur in such a high-pressure environment, and yet, the implications of these mistakes are far-reaching. They can lead to misdiagnoses, incorrect treatment plans, and even patient harm. This is a reality that we cannot afford to ignore. We must strive for accuracy, for perfection in every draw, every test, every diagnosis. Because at the end of the day, it's not about numbers or statistics. It's about the lives that hang in the balance, the individuals whose health and well-being depend on our precision and expertise. Stay with us as we delve deeper into this issue, and hear first-hand experiences from medical professionals on phlebotomy mistakes. Now, we'll hear from medical professionals who have encountered these errors in their practices. Phlebotomy, while seemingly straightforward, is a delicate task that demands precision and knowledge. Professionals from various fields have shared their experiences to highlight the impact of phlebotomy errors on patient care and diagnosis. First, we have a story from a seasoned nurse, Alexa. She recalls a day when a rookie phlebotomist, despite having been trained, collected a blood sample without the necessary protective gear. The patient had a highly infectious disease, and this mistake could have had serious ramifications. Alexa emphasizes, safety protocols aren't just for the patient's protection, but yours as well. Next, we have Dr. Sam, a respected pathologist. He shares an instance where a mislabeled blood sample led to a wrong diagnosis. It was a wake-up call for the entire team, underscoring the importance of meticulous labeling and double-checking every detail. He states, one small misstep can lead to a cascading series of errors, impacting a patient's life dramatically. Then, we have a tale from a laboratory technician, Maria. She recounts an incident when a blood sample was improperly stored, leading to hemolysis, and rendering the sample useless for testing. This not only delayed the diagnosis but also caused undue stress and inconvenience to the patient. Maria underlines, proper storage is as important as the blood draw itself. It's an essential part of the process that can't be overlooked. Finally, we have a story from a veteran phlebotomist, Joe. He talks about a time when a colleague used an incorrect needle size, causing discomfort and bruising to the patient. Joe stresses, knowing your needles is crucial. We owe it to our patients to ensure their comfort during the procedure. These stories underscore the importance of proper phlebotomy practices. Next, we'll explore common mistakes and how they can be avoided. From inaccurate labeling to improper needle disposal, mistakes in phlebotomy can take many forms. Phlebotomy, as we know, is a delicate procedure. It's not just about drawing blood, it's about ensuring patient safety, accurate results, and a comfortable experience for all parties involved. Let's delve into some common phlebotomy mistakes and their potential consequences. First off is patient misidentification. This is one of the most frequent errors and can lead to serious consequences such as improper treatment or even legal issues. It usually happens when the phlebotomist fails to confirm the patient's identity properly, either by not asking for identification or by not cross-checking with the patient's wristband. Next up, incorrect tube use. Each color-coded tube contains a different additive for specific tests. Using the wrong tube can lead to inaccurate test results, potentially leading to incorrect diagnosis and treatment. It's crucial for a phlebotomist to familiarize themselves with the various tubes and their corresponding tests to avoid this error. Finally, let's touch on poor technique. This can range from incorrect needle insertion, which can cause patient discomfort or vein damage, to inadequate mixing of blood samples, leading to clotted or hemolyzed samples and inaccurate results. Good technique is not just about skill, but also about patience and attention to detail. Now, these mistakes might sound alarming, and indeed they can have serious implications. But don't let it scare you. Phlebotomy is a highly skilled profession with rigorous training and standards. These errors are not the norm, but rather cautionary tales to remind us of the importance of adhering to best practices. Remember, mistakes are a part of learning. They offer valuable lessons and opportunities for improvement. It's through understanding these common phlebotomy mistakes that we can work towards preventing them. But fear not, these errors can be avoided. Coming up, we'll share proven strategies to prevent these common mistakes. So, stay tuned for tips on how to provide the best patient care in phlebotomy. Preventing phlebotomy errors is not only possible, but crucial for patient safety. So how can we avoid these common mistakes? Let's dive in. Firstly, it's essential to follow proper identification procedures. This may seem like a no-brainer, but you'd be surprised how often this basic step is overlooked. Before you begin the procedure, make sure to check the patient's name, date of birth, and other identifying information. Never, and I mean never, rely on memory or guesswork. A simple mix-up could lead to serious consequences. The second tip is using the correct tubes for blood collection. Not all tubes are created equal, and using the wrong one can lead to inaccurate test results. Remember, tubes with different colored tops are designed for specific tests. So before you start, double-check that you have the right tube for the test ordered. If in doubt, refer back to your training or ask a senior colleague. Next, let's talk about needle disposal. It's shocking how many phlebotomy errors occur due to incorrect needle disposal. After the blood draw, the needle should be immediately placed in a sharps container, no exceptions. This not only helps to prevent needle stick injuries but also reduces the risk of cross-contamination. One more tip, never rush. Phlebotomy is not a race. Take your time to do it right. This not only reduces the chance of errors but also helps to put the patient at ease. Finally, continuous learning and practice are key. Phlebotomy, like any other skill, requires constant honing. Keep up to date with the latest techniques and guidelines. Seek feedback from your colleagues and learn from your mistakes. Remember, the goal is not just to draw blood, but to do it safely and effectively. By following these tips, you can significantly reduce the risk of phlebotomy errors. But how do we ensure better patient care during the process? Let's find out. Ensuring patient comfort during phlebotomy is just as important as avoiding mistakes. When it comes to providing superior patient care, a gentle touch can make a world of difference. A light, steady hand not only minimizes discomfort, but also reduces the risk of bruising or other complications. But the care we provide isn't just about physical touch, it's also about communication. Explaining the process to a patient can help alleviate their fears and anxieties. It's important to remember that for many people, phlebotomy can be a nerve-wracking experience. When we take the time to explain what we're doing and why we're doing it, we can help put our patients at ease. Remember, knowledge is power. When patients understand what's happening, they're likely to be less anxious. So, be open and honest. Tell them what to expect during the procedure and how long it will take. If they'll feel a pinch or a slight sting, let them know. Transparency builds trust, and trust is the foundation of good patient care. And if a patient does express discomfort or anxiety, it's crucial to address it promptly. Don't dismiss their feelings. Instead, acknowledge their concerns, reassure them, and if necessary, adapt your approach. Maybe that means taking a moment to let them breathe, offering a comforting word, or adjusting your technique. Whatever it takes to make the process more comfortable for them. Lastly, don't forget the power of a warm smile and a friendly demeanor. These small gestures can go a long way in creating a positive environment and enhancing the patient's overall experience. By minimizing errors and prioritizing patient care, we can improve the phlebotomy process for everyone involved. If you found this information useful, share this video with others in the medical field. Together we can work towards better patient care, one blood draw at a time.